Hello, I'm Kayla Blanchard. I'm the Health Equity Promotion Liaison for Otero County Community Health Council. And when asked the question, why do you vote? A quote from author Sharon Salzberg comes to mind. Voting is an expression of our commitment to ourselves, one another, this country, and this world. So, I vote for myself, my family, your family, the family down the street, and all the families across the nation. Every voice matters, and everyone deserves a seat at the table to discuss matters such as access to proper health care, gun reform, the housing crisis, LGBTQ+ rights, Native American voting rights, and so many other issues that determine the trajectory of our lives. Our local initiative vision is for all people in our community to have a fair and just opportunity to participate in our democracy. We promote practices, policies, and systems that support voter participation and civic health. So we make use of opportunities to support voter participation and civic health in diverse clinical and community. One such opportunity is here at our fiscal agent, the Counseling Center, which is a nonprofit community-based organization. So here we're able to engage with professionals who are dedicated to meeting the needs of our community members. In addition to training employees on how to optimize the use of badges and lanyards to ensure that everyone has access to voter registration, early voting, and absentee voting, we are also putting up in the waiting areas so people are able to either text that code or scan the QR code to be taken to a landing page where they can access those different features for voting. Now, while clinical and community settings are a perfect opportunity for us to engage with professionals who are dedicated to looking after the well-being of our community members, this also presents as an opportunity to engage with our community. By meeting people where they are, we're able to learn from them what their needs are and what their wants are in order to provide them with the resources to exercise their fundamental right to vote. So from attending Juneteenth celebrations to exploring the process of reinstating voting rights for formerly incarcerated individuals, we are able to make voting more accessible to people by listening to their needs and giving them exactly what they need to succeed. To help everyone get a seat at that table, we are participating in a 7-month civic health fellowship with 100 other advocates from all over the United States. We encourage local healthcare organizations to join the Vot ER initiative and are integrating civic health into healthcare and public health educational settings and curriculum. Also, we are participating in the Civic Health Month, which takes place in August. It's a national month dedicated to focusing the nation's spotlight and media attention on patient and provider civic engagement. So as people vote more often, they are labeled as likely voters and campaigns start contacting them, at which point a positive feedback loop begins to take shape as their issues related to health, housing, education, food, etc. begin to be prioritized, influencing outcomes downstream. So when people vote, campaigns are more likely to address their needs. So it's in everyone's best interest to take that seat and use your voice.